This video is sponsored by DisabilityQuotes.com. They have been helping residents and also practicing physicians find the right type of disability insurance for the past 20 years. This is a type of insurance that ensures that your income continues in the event that you cannot continue practicing medicine. It's important. So important that I personally have disability insurance. Click on the link below in the description for a free quote from them today.
Okay, my name is Nathaniel Neal. I'm a pediatric transport nurse. Basically, we pick up critically ill patients from outside hospital that doesn't have the specialties to take care of those patients, and we bring them back to a level 1 trauma center.
Okay. And what type of education is required to become a pediatric transport nurse?
You have to have a 4-year degree in nursing and also have spent at least about 4 years in a pediatric intensive care unit. Yeah.
Okay. And so basically when patients are very sick, either at certain hospitals or other locations, you pick them up in a helicopter or other type of aircraft?
Yeah, our transport, we do ambulance, helicopters, fixed wing planes, or jets. We've flown patients from to Mexico, as high up north as North Dakota, and as far east as Florida. We haven't gone to California yet, but yeah, we fly, pretty much anywhere in the United States.
Okay, and these are pretty critically ill patients. They're sick patients. What type of injuries would you usually see?
A lot of our patients are newborns with cardiac, congenital heart defects. In this population we have here in San Antonio, we see a lot of diabetic kids. We see a lot of kids that with CSF, respiratory problems. I mean, any critically ill patient that needs to be brought to a higher level of care, we pick those kids up from the outside hospitals and bring them back to our hospital. So
these are critically ill, intensive care kind of unit patients. And that's why you required to have ICU experience before this.
Yes.
Okay.
Yes.
And how often do you fly?
Our team can fly. We usually fly about maybe 13 cases a month, but in between that, we pick up patients that are from outside clinics. We have here in San Antonio, we have a pretty good patient population with seizure kids or like I say, diabetics, asthmatics. So anywhere from newborn kids to age 18, we pick them up.
Okay, and what is a typical day for you, or shift? Kind of starts at what time and ends at what time?
Well, we do 24-hour shifts here, and when I come in, I have to check my equipment. This is our bag that has all of our equipment we need to take care of our patients. We have medication bags here that have most of all our medications in it. This is our IV fluid bags and everything we need to administer IV fluids to patients. We have in this bag up here we have all of our needles, start IVs, that bag.
So basically anything to take care of a really sick patient.
Anything to take care of a patient. This is our monitor defibrillator.
And what is a defibrillator for people don't know?
And defibrillator, we can monitor a number of vital functions on here. We can do EKGs. We can monitor heart rate, blood pressure, O2 sats, and if we need to shock patients when they go into cardiac arrest, we can also do it with this right here.
Okay. And is it pretty loud to be on a helicopter, or is that pretty hard to take care of a patient on a helicopter?
Yes, it is. Yes, it is. But we have let's see, where are our? Okay, I'll get things straight. We have helmets that we wear that have our. I was trying to see if we had one in here. We have helmets that we wear, and it has the speakers on it, so we can communicate with other nursing people that's with us, and we can also communicate with the pilot. So it's pretty loud. It's pretty loud. Yeah.
Gotcha. So the patients, they come in on a helicopter and they land on top of the roof at the hospital.
Yeah.
And then they transport them to the ER.
And then we bring them to the ER, to the ICU.
Okay.
And very small babies, we have the really newborn babies. We have what we call a baby pod, and it looks like a. Actually, this is it right here. So this is called our baby pod, and we put the newborn babies in here, and we secure this onto our sled here, and we transport the very newborns in this right here.
Does that keep them warm also?
It does not have a heater, but we have what we call a thermal pad, and what we do with this right here. There's a little chip in here that we break that chip, and it's a chemical in here that warms this device up, and we put that at the bottom of the baby pod and cover it with a blanket, and then that keeps the babies warm.
Gotcha. So this 24-hour shift, your night can change at any moment. You can be on a helicopter going somewhere to pick up somebody.
That's right.
Okay.
And it's a long. It's a long shift too, so I mean we can probably do as many as I think the most we've done is maybe 4 flights in a 24-hour shift, but that's pretty exhausting. Yeah.
And then you're on for 24 hours, and then you're off, or?
Well, I'm on for 24 hours, and then we do 36-hour weeks. So I'm on for 24 hours, and I might be off for 5 days and do a 12-hour shift, and then we'll repeat that next week. Yeah.
Okay. And if someone completed all their training and then they got the certifications, what certifications do you need to become one?
Certifications to become a pediatric transport nurse, we need NRP, with neonatal pediatric resuscitation. The PALS, pediatric advanced life support. We also need ACLS. We have a certification for flight nurses, a certified pediatric transport nurse certification. We need certifications in emergency room, so emergency room nurse certifications, and of course just your BLS, basic life support,
Gotcha.
Stuff like that. So yeah.
The little small infants, the newborns, the breathing tubes are so small. Do you have one of those breathing tubes?
Yes, we do. Yes, we do. And this right here is the nursing bag. This is the nursing bag, and this is the respiratory therapist bag. And our team is made up of 2 people, nurse and a respiratory therapist.
Okay.
So,
and you're on the phone with the doctor during this time of this flight, or is there a doctor on the flight as well?
No, there's not a doctor on the flight. So when we go out to pick these kids up, you have to be very good at actually describing to the doctor what you see and the condition of the patient. and then you sort of coordinate the care for the patient with the doctor. And you try to stabilize the patient before you get in the aircraft, because there's not that much room in the aircraft. So if something goes wrong, you're in a cramped space, and things can get very serious very quick. But yeah, we have all of our tubes here for babies, and I think
when a baby's not breathing, this tube can help the baby breathe. Put that down their mouth.
Yeah, we put this tube down in the in their airway, and we help them breathe with this tube here.
Okay. And any other advice you have for someone who's interested in this career field? What kind of advice would you give them?
I would say you have to be comfortable working in a hospital and actually seeing what actually goes on in the hospital. I mean, one of the things that some of our nurses do, they actually volunteer to work in the hospital before becoming a nurse. So while they're in high school, they volunteer at the hospital, and they get to follow a nurse around, and they actually see what goes on in the hospital. So I would probably say, start with volunteering, and then there's a lot of people around that's willing to give you any kind of information you want about a career in nursing.
Awesome.
So, but it's very very rewarding, and I love it. I love it.
Awesome. Thank you so much.
Yeah. All right. Very welcome.